Well, thank you so much, Emily, for that very kind introduction. And thank you for that beautiful tribute for Congressman John Lewis, who has been a hero for many of us in this health equity movement. And I'm so excited to join this virtual rally and celebrate the role that Medicaid has played in elevating health equity. I have a little bit of bad news, and then I'm going to follow up with a whole bunch of good news. The bad news is that we're all living in concerning, tumultuous, and perilous times. There's no escaping that reality. Every day we as a country lose precious and irreplaceable lives to COVID-19. And I know that virtually every person you will hear from today and every person listening is doing everything that they can to stymie the spread of the virus. But I also know that it can be difficult and exhausting to search for the good in the midst of chaos. Yet that is exactly what we must do. The good news is that there is hope, and not just hope that we will turn the corner on the spread of this virus, or that we'll have a vaccine soon, but hope that rests in the fact that we as a country have overcome obstacles of this magnitude before. And more importantly, that we have tools in place that will aid us in doing so. I don't know if you all know this already or not, but I'm going to let you in on a little secret. Medicaid saves lives. The reason Medicaid saves lives is because at the very core of this great program, you will find a key tenet that should be at the core of every facet of health: equity. The fight for health equity was the driver behind the initial implementation of Medicaid. The fight for health equity is the momentum that keeps Medicaid as an invaluable tool. And the fight for health equity is going to be vital to ensuring our country has a healthy and thriving population for years to come. You see, the destiny of Medicaid and health equity are intertwined, and that is both intentional and beneficial. I say that because Medicaid is one of the greatest equity-focused health policies that we've ever been able to realize in the United States. And accomplishing such was not by happenstance. It took a deliberate and concerted effort to bring it into fruition. More specifically, it took the political determinants of health to get us here. I'm certain all of us are intimately acquainted with the concept of the social determinants of health. The social determinants of health call out and speak to many of the unintended and intended byproducts of our society that harm some of our most vulnerable and under-resourced communities. Stating that it's necessary to understand and address the social determinants of health would be a massive understatement. But a moment like the one we're all currently living through requires that we go a step further. So I want to call your attention to those upstream determinants that I've coined as the political determinants. For every social determinant that you can think of, there was a preceding political or policy decision that yielded that result. These political determinants dictate how long we will live on this earth and the quality of life that we will have on this earth. Housing issues, a zoning board made a decision. Availability of public transportation or transit, city officials had a say. Quality of education, very likely your state legislature most likely had input on the allocation of resources for your school. And I could go on and on. The point that I'm trying to make is that in order to truly effectuate change, you have to look towards the instigators of these inequities, the political decisions themselves. Actually, I have a little bit more bad news, and then I promise it's only going to be sunshine and rainbows moving forward. The bad news is that Medicaid, for all the good it brings, requires you and I to keep fighting for it, especially today. There is no denying that Medicaid elevates the health, including the mental and behavioral health of communities that need it most. And we could spend the next hour discussing what it has done to reduce health inequities in communities of color, but we cannot take for granted that it will continue to do so in perpetuity. Back to the good news, which is that if you're taking time out on a Thursday evening to attend a virtual rally centered around Medicaid, you're already enlisted in the fight for health equity. And more importantly, you're not in this alone. In this time of social upheaval, in this period of public health crisis, knowing that people before us were able to pull on the levers of government to pass and implement a health equity-driven policy that continues to greatly benefit our society should be a great motivator. It should also serve as a reminder that while political decisions may impact our health, politics has no place in access to care. If I can leave you with anything, it's this. Be proud of what we've accomplished so far, keep pushing for more equitable responses, and be persistent in addressing the political determinants of health. Thank you, everyone, for your unwavering commitment, your tireless advocacy, and remarkable leadership thus far.